Monday, December 5th. My name is Dr. Philip Ross, and today what I'm going to be going over roughly from the 10 to 10:30, 10:45 or 10:45 minute window is pain, and we're going to talk about different types of pain and how to alleviate your pain. So let's preface it with this to start. When we talk about pain, I'm a firm believer in not chasing symptoms. I'm not a symptom chaser. However, there's certain times when you experience pain, whether it's you roll your ankle, whether you're picking up a case of water out of your trunk and you feel a tweak in your back and you're experiencing pain in your back. That's a little bit more local, but we have to understand where the pain's coming from and treat the source. So I would just say when we start off, I'm going to kind of dive into how your body perceives pain and then how we could treat it. So the Webster definition of pain is a basic bodily sensation that is induced by a noxious stimulus and is received by naked nerve endings. So what happens is when you have injured tissue, whether it's from a mechanical irritation, you rolled your ankle in the parking lot, or if it is pain due to lack of blood flow. So if you have a peripheral artery disease, whatever affects the tissue in inflammation, that is going to kind of send the pain, the nociceptive receptors up to your brain, and that's how you're going to experience pain. So there are a couple different types of tissue damage. You could have tissue damage from pressure to tissue, necrosis due to insufficient blood flow, blunt trauma, injury, or sprain and strain of joints and ligaments. And that affects what's called the GTO, the Golgi tendon organ, and the muscle spindle. So right here we just have a small depiction, and this just basically talks about if you have an injury, and at the site of injury, what happens at the cellular level. So when you have an injury, the biggest thing that happens is inflammation is going to go to the injury. So you have, it's called your fibroblasts, and you have your macrophages, which is kind of like your cleanup crew. So we'll just take, the example of you hit your thumb with the hammer. And so what's going to happen is when you have any kind of tissue degradation, what's going to happen is you're going to get inflammation locally at the thumb. And what happened is the inflammation, basically the fibroblasts will go in and then it'll put more collagen down. And then if you kind of look at this depiction here on the screen, initially you're going to have the inflammatory response, and that's when the macrophages and the cleanup crew come. And then after that, you're going to have fibroblasts, which are basically just going to create more collagen. And then if you look at the third depiction over there, that is your scar tissue. So a lot of times when people have an injury, say it's even a couple years ago, Doc, I messed my elbow up pretty bad and I'm still having some pain and it just feels tight. The reason why it usually feels tight is because when you heal, you're going to have the fibroblastic activity, and then you're going to have, it's called scar tissue. So think of, let's take a hamstring muscle. So your hamstring muscle, everything should be kind of gliding linear like this. What happens is when you have an injury, your fibroblasts are going to drop collagen down, but your collagen is just going to be disorganized. So a lot of times when people say I have a knot, it's kind of like a trigger point. So instead of being nice and linear and longitudinal like this, your trigger point is going to be kind of disarrayed, so to speak. So then you're going to have a trigger point there. So what we do and how we treat it too is we heat it up, and then basically we're going to work on the tissue to kind of help break down and get rid of some of that scar tissue so you're back to your physiological normal when you're moving. All right. And I would say mainly most pain is going to be inflammation based, as stemming from inflammation. So when we think of inflammation, what happens is it's a chemical response to an injury in the body. So whether it's chemical, biological, physical, burns, all injuries are basically going to have the same physiological events of instilling an inflammatory response. So what we have to do is we have to talk about the inflammation and get rid of the inflammation correctly, and then long term, whether it's supplements, whether it's just a better diet, we're going to try and get your body to produce less inflammation if you have a tweak of any kind of injury in your body there. So basically what happens is we at first we have to get rid of the acute inflammation. Now, before we talk to how we're going to treat the inflammation, if you sprain your ankle within the first like 1 to 3 days, you actually want a little bit of inflammation, just because that is going to help when we were talking about the macrophages, the cleanup crew. So any kind of tissue damage, we actually need inflammation to go to that area in your body to start the healing process, to start the cascade of the healing process. However, so say you sprain your ankle and a week, 2 weeks go by and you're getting to 4 weeks. If you still have inflammation in your ankle, this is bad. You would like inflammation 1 to 2 up to 3 days after an injury, but then after that, we got to get rid of the inflammation so you could heal, and you heal 100%. So, in inflammation, we'll just take like a lateral epicondylitis. If you ever heard anybody say, I have tennis elbow, the suffix itis basically means inflammation, and then that's basically how we're going to get rid of that inflammation to treat you. So different types of ways to eliminate inflammation. So changing up your diet. So a lot of people hear anti-inflammatory diet is going to be decreasing your carbohydrates and increasing your fats and proteins. So how that works is your brain's the top dog. So your brain needs water, sugar, and oxygen. When you don't have any kind of carbohydrates, that basically carbohydrates, when they break down into glucose, and that's going to stem inflammation. So it's very common when during the holidays around this time when I don't see people for months, and all of a sudden they come in either in December or January, dog, my back was feeling good, and all of a sudden my back started hurting again. Well, what did you eat over the holidays? A lot of people go on the sweets. A lot of people eat high carbohydrate intake, and that's just going to stem your inflammation. So that's one of the easiest fixes, honestly, just to have a lower or reduce your carbohydrate intake, because carbohydrates, when they break down, they're just going to stem inflammation. Different things such as anti-inflammatory agents, so steroids. So if you ever had a slip disc bulge, disc herniation, there's a time and a place for everything. So when I have someone coming in and they say that they slipped a disc in their back and their back's killing them, they're having the numbness, tingling, burning pain running down their leg. If the patient can't even lay on his belly to receive treatment, or if they're in such excruciating pain they can't sleep, just their activities of daily living are just severely compromised, sometimes you almost need a steroid or a Medrol dose pack or prednisone to kind of decrease the inflammation, because again, that in that situation, a disc injury, that's all inflammation based. NSAIDs as well. Some people like to take NSAIDs. I would rather have someone do a natural substance. So our X-Flame's great, Inflam's great, turmeric, quercetin, bromelain, just any kind of natural anti-inflammatory just to decrease your inflammation. You could also do this with cryotherapy. So I always yelled at my mom growing up, oh, Phil, you hurt your knee, put some ice on it, put some ice on it. I never want to listen to her. 3 days after your injury, if you're still having swelling, pain, inflammation at that site of injury, you should probably put some ice on it just because you want to get rid of the inflammation. We also have a class 4 therapeutic laser that's great for anti-inflammatory properties, and Normatec compression boots, which we'll dump into a little bit later here. Okay, so when you have any kind of damage to tissue, basically we're going to talk about now your perception of pain. So when you have tissue damage, how does your brain pick up, hey, this hurts, I'm going to have pain at this site? So this was an article that came out in a journal of neuroscience, and basically when all this is basically saying is your pain, nociceptive fibers, they will use C fibers to send signals to your brain. Your C fibers are slow, unmyelinated, so actually that's low man on the totem pole, so to speak, to try and trip your brain. So when we talk about like tripping your brain, these are the types of nerve fibers. So the main ones, type 1A, type 1B, 2, 3, and then your C fibers are, if you look down here, they're low man on the totem pole. They're classified as type 4, and it says nociceptors, which is basically pain. They are unmyelinated, so myelin, basically around a nerve, is, think of like a speed boost. So that is low man on the totem pole, so it's not myelinated, so it's slow, and it's one of the thinner in diameters out of all the other sensory fiber types. So how we trip your brain to stop experiencing pain and to get you out of pain is by stimulating these different types of nerve fibers. So the 1A, the 1B, the 2, and the 3. And we could do that a couple different ways. So how we do that is proprioception. So proprioception is an umbrella term on basically how your body perceives itself in space. And it does that by a couple different things. So one of the main things is your mechanoreceptors. So Your mechanoreceptors basically give you proprioception by touch, pressure, vibration, and there are other types of mechanoreceptors, including the muscle spindle and the Golgi tendon organ that actually live in the muscle. So the umbrella term for this is the somatosensory receptor, somatosensory cortex. So all this is basically saying is, if we can stimulate your mechanoreceptors, remember they are type 1A, so they are the fastest to the brain. So let's take a knee injury. Say you're having knee pain. Basically what's happening is your C fibers, those unmyelinated fibers, are reaching your brain first. How we could kind of trip that is we increase the stimulus to the mechanoreceptors. So when we were talking about the touch, 2-point discrimination, deep touch, light touch, just kind of going across the skin, that is going to stimulate those mechanoreceptors, that type 1A. So you're going to have that faster stimulus to the brain, and it's going to kind of override the pain. So if anybody's had an injury in the past and you go to physical therapy, a lot of people will ask, hey, what are they doing with you at PT? Well, one of the first things they're doing is they're putting me on like an ultrasound machine with the TENS unit. So TENS unit is very, very popular. I hate to be the bad news bearer here, but that's basically just trying to just trick your brain. So when you actually get the TENS unit pads and they kind of put them on your shoulder for shoulder pain, why that works and why you don't experience in pain is when they put those pads on and then you kind of feel that a little electroshock in your shoulder here, that's stimulating those mechanoreceptors. So we were talking about the mechanoreceptors type 1A, fastest stimulus to the brain, and then your C fibers, those nociceptive, the pain fibers, are the low man on the totem pole. When these TENS unit basically hit, and they're listed on this on my PowerPoint here. So the Ruffini endings, Pacinian corpunctal, Merkel's disc, you're basically trying to stimulate those mechanoreceptors to override the pain signal to your brain. So in theory, yes, it will bring a little bit of blood flow to the area when you have the TENS unit pad on, but you're basically just trying to trick your brain to get out of pain and feel the tactile stimulus from the mechanoreceptors. So sorry to bust anybody's bubble if they're thinking the TENS unit pads is really doing a lot, basically just trying to override your brain. So basically what we do in here, myself and Dr. Orbach included, we are basically trying to do everything to just basically try and change the way your brain is going to perceive different stimulus to your body. All right, and so we were just talking about how to stimulate the different kinds of mechanoreceptors. So you have light touch, deep touch, 2-point discrimination, deep heat, pressure across the skin, and stretching of the muscle to activate the GTO and the muscle spindle. So let's take a runner. So last month we had the turkey trot, the 5K race, and say someone's been training for the 5K and they came in, Doc, I'm feeling a little bit of like Achilles pain. I think I have that Achilles tendonitis. So what we could do to kind of get rid of the pain, first, check if there's any inflammation. So if they're having an acute flare-up, again, we want the inflammation there from like roughly 1 to 3 days. So your macrophages, the cleanup crew could kind of come and get rid of all the tissue damage and get it out of your heel and closer to your Achilles tendon. And then what we're going to do is, once we get rid of the inflammation, we are going to stimulate these mechanoreceptors. So the light touch. So we use a tool. It's called instrument-assisted soft tissue mobilization. Long story short, it just kind of looks like a glorified butter knife. And when we go over the skin, that soleus and the gastroc, your calf muscle, we are basically trying to trip the type 1A fiber, the fastest to your brain, and stimulate that so you're not feeling the C fiber, which is going to be the pain. Deep touch. So when we do our pin and stretch, basically just to put more length in the muscle, that's going to stimulate some of those mechanoreceptors. Deep heat from the class 4 therapeutic laser. Again, we're just trying to get the type 1A, all those mechanoreceptors, to your brain quicker to override the C, the low man on the totem pole, unmyelinated fibers. Also how we could do this too, so the muscle spindle and the GTO. So your GTO is called a Golgi tendon organ, and you have a GTO and a muscle spindle in every muscle in your body. So that is basically activated due to quick stretch. So what we do in the room is when I call it pin and stretching. So when you have an Achilles tendonitis flare up, usually your calf, two different muscles, your gastrocnemius and your soleus are usually a little bit tight just due to the strain on the Achilles tendon. So what we do is we shorten the muscle down, pin it, and then stretch it back out, and that is going to stimulate that GTO in the muscle spindle, basically to, again, override that nociceptive C fiber so you don't experience the pain. In the treatment room, so we were just talking about some of the things we do. So the trigger point therapy. I like to do a ton of soft tissue. Nothing wrong with an old school chiropractor, but if you're just basically adjusting certain segments in your body, just in my opinion, I feel like you're missing half the battle. So all of these muscles, ligaments, and tendons are going to attach to bone. So if we put some motion in the bone and you receive a chiropractic adjustment, that's great. But if we don't work on the soft tissue that attaches to the bones, you're not going to make a full recovery. So that's usually what I'm doing in the treatment room is not only you're getting chiropractic adjustments, but we're also going to work on soft tissue structures just to make sure you make 100% full recovery and get the best response. So we were talking about the pinning and stretching. The class 4 therapeutic laser, that also works on a couple different channels on a nerve too. So without going too deep into it, you also have 3 channels on a nerve. You have a potassium, a sodium, and a calcium ion channel on the nerve. To turn these different channels off, we have to do different things to stimulate them. So to turn off the potassium ion channel on the nerve, that's basically from mechanical irritation. So, doc, my low back's hurting. I'm kind of feeling it. The symptoms bleed into my glute or to my hamstring. How do we get rid of that? First, we're going to get rid of the mechanical irritation, so turn off that potassium ion channel. Second, the other channel, you have a sodium ion channel, which actually is turned off by lidocaine. So we usually turn off 2 of the channels in here on the nerve when you're feeling any kind of like radiculopathy or running pain. So we'll turn off the potassium channel through the mechanical stimulation, and then the calcium ion channel. So when you're having low back pain that's running into a glute or a hamstring, think of a straw with a bunch of holes in it. So it's kind of like a leaky straw, so that nerve keeps firing, so you keep feeling the symptom of the pain running. When we get that laser over the nerve that is affecting that certain tissue, what it's going to do is it's going to try and patch up the calcium ion channel, patch up the holes in the calcium ion channel, so you don't have any holes in your straw, so you don't have a quote-unquote leaky nerve. So that's why that class 4 therapeutic laser works so well with any kind of not only diabetic neuropathy patients, any kind of disc or pinched nerve in your back where you're having pain in your back running down a leg, neck pain running down an arm, having numbness and tingling in my hands. That laser is no joke. One of the best things that you could do without going under the knife, without going into surgery, to kind of decrease your pain and to heal the nerve as well. We could also stimulate these mechanoreceptors by, we were talking about the instrument-assisted soft tissue mobilization, basically glorified butter knife, and we're going to kind of go in and try to break up those old scar tissue. Cupping therapy. Certain people use cupping therapy for different reasons. Some people use it for blood flow. Some people use it for detox. I use it for blood flow and to basically pull your skin and your fascia. So your fascia is basically like connective tissue. So think of a pantyhose wrapping around every single muscle. We're trying to pull the skin and the pantyhose off of the muscle to basically let the muscle and those cutaneous, your small nerve endings, breathe, basically. So they are not... So they're not getting compressed, and then you feel that pain trip. And then the other thing, lastly, what I like to do with patients is there's only so much we can do in the treatment room. I am a huge advocate of kind of self-care at home. Just a quick example of the teaching of the self-treatment to do at home. So neuropathy symptoms. So think of your diabetic neuropathy, or if you have a disc herniation and you're having altered sensation down your leg. What you could do at home, just a simple fix. Try it if you're having a little bit of hypoesthesia, if you're not having full sensation in your leg. Let's just take your foot, for example. So say, most of the day you don't feel comfortable with your foot. Your foot doesn't feel, your left foot doesn't feel as strongly as your right foot does. What you could do at home is really, really easy. And this is kind of what me and Dr. Orbach, we try and give to patients is, for example, you can get, when we're talking about to stimulate these mechanoreceptors, say you have a disconnect from your brain down to your foot, it just feels altered. Grab your finest linen at home, and for 5 days out of a week, what you're going to do is, when you're just sitting watching TV before you go to bed, you're going to grab your fine linen, and you're basically just going to kind of rub it on your foot while you're watching TV, anywhere from 5 to 10 minutes a day at night before you go to bed. Then the next week, what you're going to do is you're going to grab something more coarse, so like a brush, like I guess something you're going to use to wash your dishes. You could grab something a little bit more coarse, and you're just going to put a different stimulus on your foot. Then you could go to like a corduroy, and then you could go to the dollar store and even just get like a toilet bowl scrubber, just because it's a little bit more coarse, and you're just going to kind of rub it along your foot. So the reason why a lot of neurologists give this to their patients that are struggling with getting rid of any pain, or they're just having altered sensation or numbness in their foot, we are trying to stimulate these different mechanoreceptors. So we had the ones for vibration, deep touch, light touch, movement across the skin, and 2-point discrimination. So if you are feeling like your left foot is constantly numb and it just does not feel like your right foot, try and get different pieces of material to kind of rub on your foot. I'd say anywhere from 5 to 10 minutes a day. Twice would be great. Once a day is good as well. And you want to do that over the set of like 3 to 4 weeks, going up to 6 weeks, just different kind of materials, because again, we are trying to stimulate these mechanoreceptors to kind of wake your brain up and say, hey, we are supposed to be feeling this certain type of way in our foot, so let's make the link up there. All right, so most common presentation of pain and how we can help. So pathological injury to tissue. So insufficient blood flow to tissue. So if you have a peripheral artery disease, any kind of like, any kind of heart pathology, diabetic complications, so diabetic neuropathies, infection, and symptoms from medications. A lot of people have adverse musculoskeletal reactions from certain medications. And then we have mechanical injury to tissue. So picking up an object and experiencing pain. So doc, I was getting back from Sam's Club. I went to grab the case of water out of my trunk, turned the wrong way, my back's hurting me. Injury during exercise or sport doesn't mean you have to be an athlete, playing in college or playing in high school. That could just be you're a weekend warrior. You like to play pickup soccer every Sunday. I hear this a lot. I think I slept wrong. I must have slept wrong. I woke up and I have a kink in my neck. I can't turn my head left and right. Accidental injury. I'm a klutz, and I just was walking in TJ Maxx and all of a sudden rolled my ankle and burns and frostbite. So there's a couple different presentations of pain, and we have to treat those differently. So we'll start with the mechanical musculoskeletal pain. So there's certain supplements that you could take short and long term to kind of get rid of it. So we will take I just rolled my ankle in a pothole outside. So short term, what you want to do is you want to get on that natural anti-inflammatory. So, one of my favorite products, almost every single musculoskeletal injury can benefit greatly from the X-Flame. We have the Inflam, turmeric. So if you're taking any kind of statin, or any kind of medication like that, usually I would not recommend the X-Flame. You could go to the Inflam or like a turmeric. And then the joint support. So this is going to be kind of more long-term, short-term as well, but this rolls into the long-term treatment. HA+. So our HA+ product is great just because it has the hyaluronic acid, it has the glucosamine, and the MSM. Those are the top 3 joint support supplements on the market. The last one that you can add into there is chondroitin, but that's kind of like a low man on the totem pole there. So that's why I love our HA+. Patients do great with it just because you have the big 3 in one supplement. And then when we're talking about muscle, tendon, ligament support, green lip muscle, Ligaplex, just for the manganese properties in it as well. So short term, the rule of thumb is if you had any kind of injury, blunt trauma, stretched the muscle too quick, or woke up and can't turn your neck, you need a natural anti-inflammatory. So that is going to be the acute, and then getting into the more long-term, the joint support. So you got your HA+, you could also do your omegas as well, and then the green lip muscle in the Ligaplex. Now, when we're talking about different types of pain, so when we were talking about more pathological, so if it is from a peripheral artery disease or poor lack of blood flow. We have Circucor, the beetroot powder, just because it's a nitric oxide booster, L-arginine, and any other kind of nitric oxide booster. Basically, we are trying to open up your artery just so you could have better blood flow. Lymphedema, so we have a lymphatic tincture, and then the Normatec compression boots. People usually respond really, really well with that. So if you are having chronic swelling in your ankle or right below your knee or even in your foot, the Normatec compression boots is a great thing that you could use, and we got them here. So it works on the basis of pneumatic compression. So a good analogy is think of people when you're getting down to like the last part of your toothpaste, right? So there's two types of people. Some people that will just kind of squeeze your toothpaste roll until, okay, I think it's out, and then throw it away. And then you have certain people like myself that are like, well, if I just inch from the bottom and get everything out of here I can, we're going to kind of maximize this, right? So that's how the Normatec compression boots work. It works with pneumatic compression. So they are big boots that go around your foot all the way up to your groin. And what it's going to do is it is basically going to just pump everything out of your feet, and then it's going to work up to your calf, work up to your hamstring, and then basically what we're going to try and do is we're trying to push all the blood out of your legs, so all the lactic acid buildup, and every time you move, your cells are creating waste. So we're trying to push all the metabolic waste and the lactic acid out of your legs, and then it goes to your vital organs, gets highly oxygenated, very nutrient dense. So then when you thaw out, so to speak, when you're out of the Normatec compression boots, you're getting all that good blood flow and all the good healing factors in the blood to the rest of your tissue in your body. So any kind of lymphedema, and actually those Normatec compression boots were studied for treatment for stage 1 varicose veins as well. So you don't have to be an athlete. You don't have to, just get done with your wrestling match, your 5K. Everyday people could use them as well. And when we go to the diabetic neuropathy or pain, there's a couple different things you could take with this. So I just had a patient. He got his A1C. He brought his lab work in, and his A1C, I believe, was 10.2. Double digits is a big no-no. So I was trying to instruct him, let's just say his name is Mr. Smith. Mr. Smith, for us to truly get the sensation and the feeling back in your feet, we could definitely work on the mechanical irritation and use the laser therapy in the room. However, we have to work on everything going on in your body first. So we got him on our diabetic protocol. So we got him on the glucolyze, the pro oranges, the magnesium, and the neuropathies, and he was taking that pretty consistently. And he just came in 2 or 3 weeks ago, and he got blood work 6 months after his most recent lab work, and he actually dropped to the high 8. So he almost dropped like 2 full points in his A1C, just with a couple of just different dietary changes. Started to increase his walking. He was walking, at first he tried to increase the frequency, so he was walking usually 3 to 4 days a week. We got him up to 5 days a week, and then he started to feel good, so he started to increase his duration. So we got him on basically the diabetic protocol. We worked on his tissue with the class 4 therapeutic laser, Normatec compression boots, and his A1C dropped almost 2 full points. So those are the kind of wins you like to hear, and I guess I need to start making some kind of studies on those, because a lot of people say, well, I'm going to take all this stuff. Will I actually get better? Yeah, here you go. Case in point right there. So he's doing great now. So, and how we can help. Basically, when you come in here, I'm a huge why guy. So I prefaced it with when we started, I hate chasing pain. You really want to treat the source. Now, sometimes it's easy, for example, if you do have an injury, rolled your ankle, bumped your elbow on a door, that's pretty easy, but sometimes there's a lot more moving parts to kind of figure out where the pain's coming from. So the biggest thing is accurate diagnosis of your condition. So we have to know exactly what's going on so we could treat you, so you could reach 100% resolution of whatever you got going on. So that's the treatment. So whether it's chiropractic adjustments, we do cupping, we do instrument-assisted soft tissue mobilization, so working on the muscles, pinning and stretching. Myself and Dr. Orbach do different kind of like fascial stretch therapy. We do some ART as well. And then I'm a huge advocate. I was talking about how home exercise and stretches, because there's only so much we could do in a half an hour window. So I usually tell people whether it's second or third visit, hey, bring your phone in and we're going to see how you respond. And then I'm going to demo some exercises and stretches you could do. Take a video of it, go home, try these. And then when you come in next week, we'll talk about it, see how you did, see if we give you more or if we're just going to increase the frequency and the repetitions of those exercises. Because a lot of times I'll show patients how to do it in the room. Week or 2 weeks goes by, and then they come back in. I'm like, hey, did you try some of those exercises, some of those stretches? Yeah, I kind of forgot everything you did. So it's a lot easier if you just bring it in your phone, take a video of me doing it. So, oh, that's what he was saying, and then you can just do it at home. Also, we do a great job of helping with, instilling an anti-inflammatory diet and nutritional support. So, I mean, myself, Dr. Orbach, Jeff, we're all good at kind of helping with the anti-inflammatory diet. And Jeff, our nutritionist, he's great. If you have anything kind of underlying going on, you tried certain supplements, you tried different allopathic medications, and you're not feeling right, get on the schedule, go see Jeff. And then also, too, I'm huge with being preventative, not reactive. Unfortunately, I feel like everything in our society is just reactive. So there's a couple patients that are Medicare eligible, and so they can only get lab work basically once or twice a year if something's bothering them. There's no such thing as a wellness. So I had a patient, actually, this was just on Saturday, came in, and I was like, hey, bring in your lab work, let's take a look. Hey, they didn't check a couple different markers, like your CRP, they didn't check your D, they didn't check your B12. Why is that? And he said, well, I went in and I felt healthy, so they didn't check all that stuff, which is crazy to me because why would you wait for something to go wrong to treat it as opposed to just being preventative? That's I don't know. That's a tough one for me. I don't understand why we don't go preventative. We're always reactive. So that's what myself, Jeff, and Dr. Orbach talk about. So whatever's going on in your body, what you could do to prevent the progression of your osteoarthritis, to prevent the progression of your MS symptoms, your Parkinson's symptoms, and we could kind of just do some health coaching, whether that's diet, whether that's supplement support, whether that's exercise, just to kind of get you out of pain. So it basically, if you are experiencing any kind of pain or dysfunction, so Dr. Ross, I used to be able to run a 5K really, really easy. The past couple years has been a little bit more hard. I feel like my stride's not as long, or I feel like I don't have as much ankle mobility as I used to. Come in, get checked out. We could do a lot with increasing range of motion of joints, increasing the range of motion of muscles as well. So yeah, I would say come in, get looked at, and we'll kind of just come out with a tailored plan towards you. So it's not a cookie cutter approach. It's not like every patient coming in gets the same thing, every half an hour. It's truly tailored to you. So, I mean, I treat, anywhere from my youngest patient, it was 2.5. My oldest patient was 100. And then if you have a person basically coming with the same injury, depending on what they do at home and depending what their hobbies are, you might treat them differently. So come in, get checked out. We do lab work. I've been doing a ton of lab work recently. So if you're just feeling a little bit off or you just want to see what's going on biochemistry in your body, come in. We'll get you some lab work, and then we can get you on the correct supplements where you're deficient, and then we can always retest your lab work in like 6 months. So that is my spiel on how to get out of pain. If anybody has any questions, my email is drross@wowpgh.com. Feel free to shoot me a couple emails. My lunch is every day, 1 to 2. Or you could just call in and talk to the front office too. So a lot of people, I would say, 98 out of 100 coming in with whatever kind of pain are going to get results. So yeah, that's my pain spiel. Any questions? All good to go. All right, thanks, guys. And then stick around because we have at 11 a.m. coming in, McLean Haynes is going to be talking about the innovative ingredient of the year, immunolin. So, yes, that's right. So, stick around. Tune in at 11 a.m. And I'm going to be also presenting again, I think, Phil, we got a demo coming in Wednesday, I believe, is it 1 to 2? I think we got a demo Wednesday the 7th, 1 to 2, and basically we're just going to try and pick a patient, and then we're just going to give a breakdown of everything that we could do in the treatment room. So you guys have a great rest of your Monday, and we'll see you Wednesday at 1.